is the innermost layer.
What is the total number of bone in an adult, children, and fetus?
In an adult, 206, in children, 213, and in fetus, 306 bones are there.
What is the king of disease?
Gout,
What is encephalitis?
inflammation of brain,
What is GERD?
gastroesophageal reflux disease.
Can you explain about the categories of diabetes mellitus?
The diabetic mellitus has two major categories called primary DM and secondary DM. The primary DM is further divided into two types called type 1 and type 2. The type 1 DM is insulin dependent DM. It occurs in below 30 years of age and which is also called as juvenile DM. This type 2 DM is non-insulin dependent DM. It occurs in above 30 years of age and the type 2 DM is default type. The secondary DM is divided into three types due to underlying conditions, due to drug and chemicals, and due to other specified DM.
What is the function of coronary artery?
The coronary artery supplies blood to the heart by itself.
What is glaucoma?
Damage to the optic nerve. It has two types, that is open angle and angle closure.
What is epiglottis and its function?
Epiglottis is an elastic plate of cartilage that is located at the posterior part of the tongue. It seals over the trachea while swallowing to prevent choking hazards.
Can you explain about pancreas?
Pancreas is an organ and it also acts as a gland which secretes both exocrine and endocrine hormonal functions. It has alpha cells and less amount of beta cells. The alpha cell secretes glucagon and beta cell secretes insulin. Both are essential to maintain blood glucose level. In the exocrine part, pancreas secretes some juices and enzymes to enhance the digestion process.
What is the difference between a common vein and pulmonary vein?
The normal vein carries deoxygenated blood to the right atrium of the heart, whereas the pulmonary vein carries oxygenated blood to the left atrium of the heart.
Ectomy means
Surgical removal of an anatomical part.
expansion of DVT.
Deep vein thrombosis.
What are the secretions of posterior pituitary gland and its functions?
The posterior pituitary gland secretes ADH, that is antidiuretic hormone, or vasopressin, and oxytocin. The ADH regulates milk synthesis. Sorry, the ADH regulates fluid balance in body tissues, and oxytocin regulates milk synthesis and it increases the uterine motility.
Can you explain about ECG and its impressions?
Expansion of ECG is electrocardiogram. It is majorly done for MI cases. Need to check whether STEMI or non-STEMI in the report. STEMI means segment elevated myocardial infarction. Non-STEMI means non-segment elevated myocardial infarction. Need more attention for STEMI.
Can you explain about the structure and function of heart?
Structure of heart. The heart is divided into four chambers by septum. These chambers are called anterooms and they are right atrium, right ventricle, left atrium and left ventricle. Both atriums are called receiving chambers of the heart and both ventricles are called discharging chambers of the heart. The heart is a hollow muscular organ which is in clenched fist size. The outer covering layer of heart is called pericardium and the myocardium is a middle layer and endocardium is innermost layer of heart. The pericardium has two layers, that is superficial fibrous pericardium and two layers serous pericardium. The serous pericardium has two layers called parietal layer and visceral layer. The pericardial cavity divides the layers which is filled with lymph fluid which provides cushion support to the organ. Location of heart. The heart is located at the left of the midline in the rib cage. Mediastinum is a space between two lungs where the heart is inclined toward the left upper quadrant and in superior surface of the diaphragm, anterior to the vertebral column and posterior to the sternum. Function of heart. The inferior vena cava and superior vena cava carries deoxygenated blood to the right atrium of the heart. This blood passes through the tricuspid valve into the right ventricle. Then the blood is pumped into the pulmonary trunk through pulmonary semilunar valve. Then pulmonary arteries carries the blood to the lung. In the lung, the blood is oxygenated in the alveolar region. The pulmonary veins carries oxygenated blood to the left atrium of the heart. This blood passes through the mitral valve or bicuspid valve into the left atrium of the heart. Then this blood is pumped into the aorta through the aortic semilunar valve. Then the pulmonary arteries pumps the blood throughout the body where it eventually reaches the capillary bed. In the capillary bed, the oxygen is transferred from the blood to the surrounding tissues and the carbon dioxide is transferred from the tissue to blood. Then this cycle will be continuous.
Okay, Rasika, you missed some points in functions of